All right, so upon entering the patient's room, I do hand hygiene and provide for patient privacy. Good afternoon. My name is Angelica, and I will be your student nurse for today. How are you?
Good.
Great. Can you please tell me your full name and date of birth?
Bruce Wayne, 04/04/1985.
Okay. Verifying the information of the patient's bracelet. Okay, great. And is it okay for me to address you by your first name, Bruce?
Yes.
Great. Can you tell me where are we right now?
In Brandon region.
Okay, and what month is it?
April.
And who's the president right now?
Biden.
Okay, patient does not seem to be in any immediate distress. Patient alert and oriented times 3. Bruce, I'm here today to do an assessment on you. So I will be just moving from the head to toe fashion. If there's something that I'm doing that you have questions about, then please do not hesitate to let me know. Tell me, are you in any pain right now?
No.
No? Okay, and do you have any allergies?
No.
Any food allergies, environmental allergies, medications?
No.
No? Okay. So I'm just going to go ahead and review your vital signs. I have a heart rate of 85, temperature of 98.2, respiratory rate of 14, blood pressure 125 over 85, which are all within normal limits. So that's great. The patient does not have oxygen or IV tubing. If he did, I would inspect the tubing starting at the patient as the origin and trace it back to make sure there are no kinks. If the patient had an IV site, I would examine it for any signs of redness, swelling, infiltration, and pain. Okay, so Christopher, I'm going to start with your head. I'm sorry, Bruce. I'm going to start with your head. I'm going to inspect your scalp, your hair. I am inspecting for any lesions, checking the overall condition of the skin. The skin is warm and pink. It's dry. I am going to inspect the ears. So I'm checking for the shart with my pen light. I'm also going to check the nares. Can you open your mouth? I am checking the gums and looking for any mouth sores, any tooth decay. The mucous membranes are pink and moist. Now I'm going to check your eyes. So just look at the light at the end of the pen. Okay, now follow the light with your eyes. Right, great. Pupils are equal and reactive to light. Now I am going to check, can I please have your finger? I am going to check for cap refill. Cap refill is less than 3 seconds. I'm also going to check for skin turgor. There is no tenting. Skin seems in good condition. There's no breakdowns, no apparent breakdowns. I am also going to palpate for the pulses. So first I'm going to do the carotid. Okay, then we're going to do the radials. Okay, Bruce, do you mind scooting back for me? I need to get to your feet. Okay, fantastic. Okay, pulses are present and equal bilaterally. Bilaterally, they are strong. Okay, now I am going to listen to your lungs. Every time that you feel my stethoscope touch your skin, if you can just please take a deep breath for me. Do you mind unzipping your jacket for me, please? Okay, and I'm going to have to get my stethoscope under your shirt. It might be a little cold. Take a deep breath. Oh, take a deep breath and just nice deep breath. Okay. Breath. Deep breath. One more. And one more. All right, sounds good. I am now going to do the same on your back. Just lean forward for me a little. I'm going to lift your shirt and your sweater again. Take a deep breath. Okay. Deep breath. Deep breath. Deep breath. One more. And last one. Okay, thank you. Lung sounds are clear and equal bilaterally. Do you have any trouble breathing or any discomfort in your chest? Any pain?
No.
No? Okay, great. The patient does not have an incentive spirometer, but if he did, I would educate him on the usage and I would ask him to present it back to me. Now I am going to listen to your heart. I am going to auscultate with the diaphragm and the bell on all 5 points. I'm going to start with the aortic, which is on the second right intercostal space. Then I'm going to move to pulmonic, which is on the second left intercostal space. From there, I will go to the Erb's point, which is going to be on the third intercostal space. And then I'm going to move to the fourth intercostal space, which is tricuspid. And then for 1 minute, I'm going to auscultate on the mitral, which is 5 intercostal space, mid-clavicular line. And once again, they're all going to be auscultated with the diaphragm and then the bell. Okay, now I'm going to listen to your heart. Aortic, tricuspid, pulmonic, Erb's point, tricuspid, and 1 minute on the mitral, and the same with the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, great. We are going to move on to the GI. Bruce, can you tell me when was your last bowel movement?
This morning.
Okay, and was it normal for you?
Yes.
And are you urinating fine?
Yes.
No any pain, discomfort, burning?
No.
Okay. I will be monitoring the patient's intake and output. I am now going to auscultate the patient's abdomen. Can you please lay it flat on your back? And I'm going to take a look at your stomach. We're looking at the abdomen. We're looking for any change in size or symmetry. There is no apparent changes. Going to auscultate, going to auscultate all 4 quadrants. If there are no bowel sounds present, we will auscultate for 5 minutes. Okay, bowel sounds are present, and then I am going to auscultate with the bell for Bruce. Okay. No Bruce present. Now I am going to palpate first with 1 hand. If you feel any pain or tenderness, please do let me know. And then with 2 hands for deep palpation. Okay? Great, thank you. You can get up. Okay, do you ever feel any sensation like tingling in your feet or in your hands? Any numbness?
No.
No? Okay. Now if you could please squeeze my hands. Okay, and now pull me, holding my hands, pull me towards yourself a little. Okay, and now push me away. Okay, great. Now if you could please do the same. Can you scoot back again? I'm sorry. Scoot back again. Scoot back. No, you have to scoot back. Okay, now if you can please press on my hands like on a gas pedal. Great, again. And now the other way. Okay, fantastic. Right, do you have any concerns or any questions for me?
I don't?
Okay, fantastic. Do you have everything that you need right now?
Yes.
Okay, this is your call button. In order to call me or anyone, just hit it right here. Somebody will be with you shortly. I will be back probably in an hour to check on you. I dispose of gloves, perform hand hygiene, and leave the room, leaving the patient comfortable with the bell within reach and bed in lowest position.